Hi everyone, my name is Nolan Meyer, and I'm here today to present on my scholarly project, which is on the reduction of risk exposure for patients affected by cardiac implantable electronic device recalls and advisories. Before I get started presenting on my project, I just wanted to go ahead and talk about my committee members. So my committee members are headed by my chairperson, Dr. Carol Berger. My second reader was Dr. Bonify Stegman, and my community person was Corey Lisdahl. So to start out, I think it's important to discuss my research or PICO question and what factors led to its development. First off, my PICO question is, in patients with cardiac implanted electronic devices, or CIEDs, does initiating a shared digital dashboard tool compared to the manual process currently in place reduce the time required to complete proper notification of patients when device manufacturers initiate a recall or advisory? Obviously, this question and topic was determined through the identification of a practice problem within my facility related to processes in place that we use to make patient notification at the time of a CID recall and advisory. The previous process in place utilized hand-completed documentation, paper charting, a manual upload process, and then that was then uploaded manually into a patient's EHR. This included physical filing into a folder. Obviously, this process with our digital world in this day and age has been outdated and led to prolonged patient notification times, errors in filing, and then just increased risk for adverse outcomes such as arrhythmias, other cardiac-related concerns with patients just from the delays that it took to get this notification made. This question ultimately was developed to improve the patient notification process that was in place within the organization where I work. Obviously, our goal was just to decrease our patient notification time and improve the quality of patient care. So getting into the background, here we are going to focus more on the background behind just the overall process of just the CID recall. So completion of the CID recall process is crucial to ensure adequate patient care is being provided. Above completing the process, it is necessary to make sure patient notification is made in a timely manner, as when devices are under recall, patients are exposed to risk each day that it goes just unaddressed. Within the process, CID industry first notifies the organization of a recall, then it's up to providers to determine the best course of action and then notify the patients of next steps. So I guess the next question is why focus on this project? Increased need for CID or CIDs is projected for our future. Our population is rapidly aging, and more people are getting implanted with cardiac devices daily. Due to this, we just need to have proper management strategies just in place in general, making sure that we're ready to go when these things do happen. Lastly, this will help reduce that risk of adverse effects related to CID malfunctioning. This is, your arrhythmias, mortality, all those things. The next thing we looked at is just lastly, why are we going to utilize digitization to address this practice problem? Digitization has just been shown to be effective in improving quality of care in many studies, and we see it in our day-to-day work at the hospital as well. Mostly everyone uses an EHR. It has a lot of weight. So the next thing we kind of roll into is a literature review. We do a literature review to build support. So to build support for this project, this literature review is conducted. To complete the literature review, I ended up using two different databases. Databases included Signal and then Google Scholar. When completing this literature review, I limited the sources to be primary resources just to make sure that data was adequate. And then lastly, in total, I ended up using 18 articles when it came to supporting my research that I did. So through the completion of that literature review, I ended up kind of going through, and I guess in the end, I ended up finding three common themes throughout the majority of my research. The common themes that I stumbled upon, I guess, were implantable devices, recalls and defective devices, and then health information technology. The first theme, which was implantable devices, in this theme, CIDs are further kind of identified, described, and explained. Research and indications supporting the use for each type of device that were found throughout, all the research that I did. Of note, it's important to state that for this project, I defined CIEDs as devices that were implanted. So things such as an implanted permanent pacemaker, cardiac resynchronization therapy devices, cardioverter defibrillators, and then cardiac monitors. The next theme I explored was recalls and defective devices. In this theme, research was found defining the impacts of recalls and defective devices on patients. Obviously, that's the most important part of this, is make sure our patients are well cared for. Some of the big impacts that you'll see with these devices being defective will include changes in mortality, increased admissions, dysrhythmias, and just a myriad of other cardiac-related adverse events that for the most part will bring people back into the hospital. Lastly, health information technology was my third identified theme. In this research, I found there's lots of things often alluded to just a lot of support finding positive impacts on the use of health information technology and digitization within healthcare. Like I said earlier, Mars, everything. There's so many places where we utilize digitization and electronic record keeping within healthcare. So with completing research, it's also important to make sure that we critique our research and our evidence that we find to properly address and explore the information found within this literature review. I did complete a critique of evidence. I explored the strengths, weaknesses, limitations, and gaps of evidence. For what I found, a lot of the strengths I found, these studies focused on healthcare processes. Another strength is just that authors had appropriate credentials when completing their research, and that most of my articles, if not all of them, had adequate population sizes that showed a real change. Some weaknesses that I saw. Some of the articles were just older. I did attempt to keep everything within 10 years, and I was darn close, but some of them still were outside of that period. Another weakness that I found was that there's just a lack of research where, the electronic digitized device that they used was a digital dashboard. There's lots of studies showing that there was positive impacts from digitization. It just didn't necessarily, signify that digital dashboard was the way to go. A limitation that I found, just possible failure to report adverse events. I think that there's, many companies who it's in their best interest to not maybe report some of those things, which leads to some just possible misrepresentation of data. Gaps that I found throughout my body of evidence was just interventions applied to different populations. Places that were outside of the United States, different communities, all those things. It can really affect how research is done. Some of my articles, they didn't necessarily specify the intervention that they used within the digital world. Lastly, just literature evaluates research just from other countries. Again, it's another one of those gaps where things are just applied a little differently. So to provide structure to the scholarly project, I did use some theoretical framework. Research was completed on various models to figure out which one I was going to use, theories and frameworks to create change. For the scholarly project, I involved improving upon a patient notification process during the cardiac implantable electronic device recall advisory with the goal of reducing notification times. One theory that really correlated with this scholarly project is Rogers' 5-stage change theory. This theory is easily applied to the CID recall advisory patient notification process. In doing so, at my facility, I increased awareness to the benefits of changes and how they will be made. Secondly, I grew support amongst key stakeholders, talking with providers, people in the care team, growing that support and making it something that's desirable to add on to the program. With talking this through, we came to a decision to make these changes, adopt them, and then from there you go into the implementation stage. That's creating the shared digital dashboard, educating staff, and just working through the process of making it a standard operating procedure. And then lastly, it's just ensuring transition to the new process has been effective. We did that throughout completing the scholarly project, and we'll continue to do it in the future to make sure that we're giving our patients the best care possible. The next thing we kind of look into is methodology. For this project, a quantitative exploratory design was utilized for this just process improvement scholarly project. Participants were not engaged, rather, a retrospective chart review took place. Electronic medical records of patients identified by CID industry as affected by recall or advisory from the participating organization or hospital was utilized for data collection. During this data collection period, the minimum necessary data to accomplish the goals for this project were recorded on a data collection sheet. Just important to note that patient identifiers were not present on the data collection sheets. We made sure to ensure that their privacy was always kept. So next we kind of go into the outcomes of the intervention. We go into project design. So the design for this project, it was a longitudinal design that we completed retrospective chart review for. The setting of the project took place at a cardiology or electrophysiology department of a healthcare facility in the Midwestern United States. Participants, which we'll get more into on the next slide, they are identified by the industry. They send the facility a list of people affected by CID recall advisory. For this study, we had 198 total participants. So as promised, here's a further look into the sample. So for this study, we had 198 participants who were recognized as being affected by 2 different recalls or advisories. During this research, patients weren't engaged during the collection period. No identifiers were collected. In total, we, like I said, 198 patients over 2 cohorts. We used one that utilized the pre-intervention CID recall and advisory process to make that patient notification, and then we had one that was post-intervention as well. The pre-intervention had 146 participants, and the post had 52 participants, and it's just a pie chart showing that. So with that, we kind of get into data analysis. Data analysis for this project focused on the interval of time. Time's the big thing here. We wanted to decrease the amount of time to create that patient notification. Time to complete patient notification following the initiation of a CID recall advisory was compared between 2 cohorts before and after the initiation of a shared digital dashboard intervention. To determine if significant analysis of data was completed, we ended up using the Mann-Whitney U-test. This would let us know if our research was significant or not. And of course, with analysis, we also need to have results. So here we kind of explore our findings of the results of this scholarly project. We found that after the initiation of a shared digital dashboard, patient notification times were drastically improved. Notification times reduced from 45 to 13 days. Furthermore, the Mann-Whitney U-test indicated that this information was indeed statistically significant and showed some significant changes were made. So let's talk about strengths and limitations here. So through the completion of the research process, both strengths and limitations of the project were able to be identified. Strengths that were found through completing the scholarly project included proving that digitization as a concept is indeed efficient. We also showed that a shared digital dashboard is efficient in reducing patient notification times. Also centralizing all the information, improved tracking capabilities, as well as communication amongst team members. Then looking at limitations that we found included just the amount of time available to complete the scholarly project. If we could go and do it as more efficiently, I guess, an improved version would just be to have more time, allowing us to do additional cohorts to add into our data. This limitation was, however, reduced pretty well just through the adequate population size that was within this study. Another limitation present was just simply delays in communication that lead to delays in research and completion of this project. Lots of it was addressed by just making sure communication was made a importance at the very beginning, but it still led to some minor delays. So just kind of going into the discussion stage of this presentation, we look first into the clinical significance. We found through creating this project that a shared digital dashboard was indeed effective in reducing patient notification times. We found that through our research and our big reduction of the amount of time that it took between the pre and post intervention implementation. We also found that the analysis of the collected data showed us that these findings were indeed significantly or clinically significant. And then we kind of look next into the meaning of these results. The PICO question was indeed answered through completing this project, and we found that yes, indeed, utilizing a shared digital dashboard is a great step into reducing patient notification times at the time during CID recall or patient advisories. And then our next slide is just looking at post-implementation insights. Just some quick insights. Obviously, the big thing for this project is that utilization of digitization allows for meaningful improvements to be made within patient care. We can see that it can be used in this situation, and I feel as though it can be applied to other situations within the hospital as well. Some barriers that we ran into, I had mentioned it before, but just communication amongst staff. It's hard when you do a lot of communication through email and other various communication techniques. You can just run into bumps in the road there and delays. Some of our big facilitators that I thought really helped move this project along. The care team worked together to implement shared digital dashboard and launch new standard operating procedures. I felt like once we got the ball rolling, we really worked well and made things work as a team. Next, we just look at the use of a shared digital dashboard and new standard operating procedure, improved communication amongst care team members. It just cuts down and cuts down on the places where communication can be made and just allows for people to access that information directly. It was really nice once it got up and running. So in this next slide, we're looking at the implications for practice. The big thing here is just impact change within the recommendations. We ended up putting in place a new standard operating procedure, and we do plan within our organization to continue its use just because it did make such a big difference. And obviously, we'd recommend continue to use it just because it is a benefit to this patient population and is reducing on time and allowing for patients to receive better care in a faster format. As far as future research and work goes, we have a framework in place to apply this research and concepts to other processes within the hospital. I mentioned it earlier, it is truly something that can be applied to a lot of different processes, and it's worth looking into seeing where this tool can fit. And then on top of that, we can just continue to monitor results for this patient population, those who are affected by CD recall or advisory, and take those into account when creating future recalls or addressing future recalls or advisories. As far as sustainability goes, it's a very sustainable project. We created standard operating procedures. It's implemented into practice, and it's indicated to be continued just with the reduction of the time within the patient notification process. And we'll just continue to integrate this process and educate staff to make improvements and improve efficiency amongst the team. So, in conclusion, I think it's important just to kind of break things down again. We looked into that PICO question. It was answered through the completion of the Scholar project. That was our goal, right? Our biggest aim and plan for this project was to go ahead and answer that PICO question. We got an answer. Data indicated that this process improvement did indeed occur through the implementation of a shared digital dashboard into the CID recall process, recall advisory. Patient notification times went down. So yes, we can say that a shared digital dashboard does indeed reduce patient notification times. And then, it's important to touch on the fact that data analysis did indeed indicate statistically significant results were found within the study. The Mann-Whitney U test showed that as a certainty. It was P was under 0.001, so really good results on that end. For myself and the staff at the organization who I worked on this project with, the recommendation was to continue utilizing this shared digital dashboard and use it in this process moving forward. It's also recommended to kind of look around the organization and see if this process fits in any other spots too. If it's something that can be applied to other spots and improve patient care, it's important to try and do that. To improve patient care, other processes in the facility should be evaluated. So yeah, I just touched on that as well. It's important to always try to improve on patient care and improve on patient outcomes and try and give them the best care possible. Lastly, I just have a couple of reference pages. There's a long pile. Feel free to pause and look through them as you'd like. If you have any questions or anything, concerns, thoughts, if you want to just talk about things further, please feel free to reach out to me via email. I'm available, and I will respond in a timely fashion as I'm able to, usually 1 to 2 days. Thank you for listening to my presentation, and like I said, if you have any questions, please reach out. Thanks for your time.